How are relapsed and refractory lymphoma defined? Imagine going through treatment for lymphoma and feeling hopeful when tests show no signs of cancer. But sometimes, after a period of remission, the lymphoma can come back. That's what we call relapsed lymphoma. It means the cancer has returned after initially responding well to treatment. Usually, doctors consider it a relapse if the lymphoma reappears after at least 6 months of no detectable disease. The reason this can happen is that some lymphoma cells might stay hidden in the body even after treatment, either because the treatment only partially worked or because a tiny number of cells weren't detected during remission. Different types of non-Hodgkin lymphoma, especially the lower grade or slow-growing kinds, tend to relapse more often than classical Hodgkin lymphoma, which generally has a lower chance of coming back. On the other hand, refractory lymphoma is a different challenge. It describes lymphoma that does not respond to treatment from the start or gets worse despite therapy. If the lymphoma fails to shrink significantly, stays stable without improvement, or grows during treatment, it is considered refractory. Sometimes, it can also be called progressive lymphoma if it worsens quickly, often within 6 months of starting therapy. This indicates that the cancer cells are resistant to the usual treatments like chemotherapy or radiation. Refractory lymphoma often requires different or more aggressive treatment options because the standard therapies aren't working. Understanding whether lymphoma is relapsed or refractory is very important because it guides doctors in choosing the best next steps. Patients with relapsed lymphoma have previously responded to treatment but need additional therapy to control the recurrence. Those with refractory lymphoma, however, might need more intensive or alternative treatments because their disease didn't respond initially. Thanks to advances in immunotherapy, new options are emerging for both relapsed and refractory cases. Treatments like CAR T-cell therapy, checkpoint inhibitors, and targeted antibody therapies are being used more often to attack lymphoma cells that have become resistant to traditional treatments. The choice of therapy depends on many factors, including the specific type of lymphoma, the patient's overall health, age, how much the disease has spread, and what treatments they have already received. In summary, relapsed lymphoma is when the disease comes back after a period of remission, usually after 6 months or more. Refractory lymphoma is when the disease does not respond to initial treatment or worsens during therapy. Both situations are challenging but can often be managed with newer therapies tailored to each individual's needs. If you or someone you know is facing this, it's essential to work closely with healthcare professionals who can recommend the most appropriate treatment options based on the latest medical research and personalized care.